Welcome, everyone. Today we're diving into some critical insights around male urological health, especially focusing on common pitfalls that many men unknowingly fall into.
That sounds really important. So, what's one of the first issues that often gets overlooked in penis care?
Well, one of the major starting points is hygiene, specifically the excessive or even the improper use of aggressive soaps and perfumed products.
Yep.
Many men think more cleaning with strong antibacterial or scented soaps equals better hygiene, but it's quite the opposite.
That's interesting. So, using these harsh products can actually damage the delicate skin down there?
Exactly. The skin on the glands and under the foreskin is particularly sensitive and thin. It's like, think about it. Like if you overwash a fine silk fabric with harsh chemicals, you'll
Right.
ruin its protective layer. This overzealous cleaning disrupts the natural pH balance and microbiome, leading to dryness, irritation, and even allowing infections to creep in.
Wow, so just plain water or a really mild soap really should be enough then?
Yep, exactly. Using water, specifically warm water, is usually ideal. And if soap's needed, it should be a gentle, fragrance free, pH neutral one, only for the outer parts, with careful cleaning beneath the foreskin if applicable.
All right. So, that's hygiene. What about other risks? I remember something about certain techniques in masturbation causing issues.
Right on point. Another prevalent error is when men use excessively vigorous techniques during masturbation. Some even refer to it as the death grip, where an overly strong grip might cause microtraumas in the delicate tissues. Over time, these microtraumas can lead to scarring that affects the penis's elasticity and even desensitize the nerves so that it takes ever increasing pressure to get aroused.
That's surprising. I mean, isn't it a normal part of sexual activity?
It is, but moderation is key. Much like with any physical activity, technique matters a lot. Without enough lubrication, the repeated friction can even result in abrasions that open the door for bacterial or fungal infections.
So, using lubricants seems like a no brainer then, preferably water or silicone based.
Exactly. And if one uses varied techniques with a moderate grip, it can help avoid repetitive trauma to specific areas. It's a classic case of too much of a good thing becoming harmful.
All right, moving on then. Another major area seems to be about sexual health, particularly ignoring signs of infections. How does that come into play?
Definitely a huge concern. Many men tend to skip over the signs of potential sexually transmitted infections, like abnormal discharges, burning during urination, or even unusual sores. Ignoring these can lead to long term complications, such as chronic urethritis or even, in severe cases, implications for fertility.
Yep. It's alarming to think that something like this could be brushed off due to embarrassment.
Absolutely. The stigma and fear of judgment can lead many to delay seeking medical help, which only exacerbates the issues. Early detection is always key here.
That makes perfect sense. What about the devices aimed at enhancing the penis, like vacuum pumps and extenders? Aren't some of those even used medically?
Yes, and that's a really nuanced point. Under medical supervision, vacuum devices can assist with certain cases of erectile dysfunction by increasing blood flow. But using them improperly or excessively can lead to ruptured blood vessels, bruises, and even, in extreme instances, conditions like Peyronie's disease, where scar tissue leads to abnormal curvature. They're, well, meant to be tools in a controlled setting, not DIY devices to chase unrealistic improvements.
I see your point, but some might argue that these devices, if used carefully, could offer benefits. Isn't there some value when they're employed correctly?
Sure, under strict guided use by professionals, there can be therapeutic benefits. However, the problem is the lack of oversight when these devices are used recreationally at home. It ends up being a case of misinformed use that can cause lasting damage.
That's a fair critique. It really comes down to proper usage and setting realistic expectations.
Exactly. Now, another area that's come into focus is the trend of aggressive shaving and depilation in the genital area. With growing popularity, more injuries have been reported, from cuts to ingrown hairs that could lead to infections like folliculitis or even more severe skin irritations.
Yeah. So the ideal approach is to either carefully shave with proper preparation or consider less aggressive methods like careful trimming.
Absolutely. Shaving should be approached with care. Use a clean, sharp razor, plenty of proper shaving gel, and always shave in the direction of hair growth to avoid irritation.
And what about ignoring injuries or any abnormal changes in the penis?
That's a big one. Often men may notice unusual changes, like lumps, discoloration, or a persistent lesion, but due to embarrassment or simply not wanting to worry, they ignore it. This neglect can be dangerous, whether it's a benign cyst, early signs of cancer, or even the onset of Peyronie's disease.
Right. Sounds like any non healing or unusual change should be evaluated sooner rather than later.
Precisely. Early evaluation by a professional can make all the difference, ensuring that any problems are caught while they're still treatable.
And then there's the whole issue of the recreational use of medications meant for erectile dysfunction, isn't there?
Yes, and that's a particularly risky area. Medications like Viagra or Cialis are designed for specific medical conditions, and their use without a proper diagnosis can lead to serious side effects. We're talking about potential risks like severe headaches, visual disturbances, or even the dangerous condition of priapism, where an erection lasts too long and can permanently damage the tissue.
It seems like a slippery slope. Using these meds without prescription can, well, lead to a dependency, right?
Exactly. It not only creates a psychological dependency, but may also mask underlying health issues that need attention. It's a class of drugs that should only be used under a doctor's guidance.
Another layer to this discussion is the role lifestyle habits play, right? Things like smoking and diet.
Absolutely. The vascular health of the penis is deeply connected to overall cardiovascular health. For instance, smoking is notorious for causing vasoconstriction, meaning it narrows blood vessels, diminishing blood flow, which is crucial for an erection. This isn't just about
Right.
sexual performance, it's a red flag for broader circulatory issues.
So, poor overall health in areas like obesity, hypertension, or high cholesterol might actually be contributing to sexual dysfunction.
Yes, it's like a domino effect. Poor vascular health not only affects the penis, but it might also be an early indicator of more severe cardiovascular problems. Maintaining a balanced diet, regular exercise, and avoiding excessive alcohol or recreational drugs is a must.
It's almost like neglecting routine maintenance on a car. You ignore a little warning light and suddenly face engine troubles.
Exactly, it's like skipping your car's oil change. You might be fine for a while, but eventually it leads to breakdowns, sometimes catastrophic ones.
That's a great analogy. So, tying it all together, what's the overarching message here?
In essence, the core takeaway is balance and informed care. Whether it's hygiene, technique during masturbation, safe sexual practices, cautious use of enhancement devices, or lifestyle choices, each of these areas plays a crucial role. Men need to treat their urological health with the same diligence as any other aspect of their overall well-being and be proactive in seeking professional advice when something seems off.
Absolutely. And breaking the stigma around discussing these issues openly can only serve to enhance prevention and timely treatment. Thanks for this deep dive. It truly highlights the complex, intertwined factors of health and the importance of being well informed.